We'll continue looking at the prescription and dispensing of the prescription. Last week, we looked at how you handle a prescription when a prescription is presented at the pharmacy. And we said that the first thing that happens is receiving of the prescription. And when you receive your prescription, you have to confirm that the prescription is for the right patient. There are many tools that are used to actually handle prescribing and dispensing at the pharmacy. Sometimes you may get prescriptions that come in through a system, through a digital system, okay? So that you are calling the patient's name and the patient is coming, okay? Because you can see their prescription in the system. They may not physically bring you a paper. So we said it's important for you to actually confirm that you have the right patient, okay? The patient may bring you a physical prescription, okay? And again, as you're dispensing the items, when you call out the patient to come and pick their drugs, okay, it's important that you confirm the patient who is picking the drugs is actually the right patient. So we talked about receiving, then we talked about carrying out a clinical and legal check, okay? And we said that when you're carrying out a clinical and legal check, these are the things that you check. You check the patient, the dose of the medicine, the patient's condition, and other medications that the patients may be taking. And to be able to help us do this in a complete way without disregarding important information, we said we use the acronym IDEAL CASE. And the first thing we start off with is we look at interactions. That prescription that you have been given and the medicines that are there, is there potential for these medicines to interact, okay? For instance, when you talk about if you have tetracycline, okay, on the prescription, okay? There are different tetracyclines that you will find being used. Things like doxycycline, minocycline. If you get such a drug, we know that this drug will actually interact with milk, okay? So what would you tell the patient? Bruce, Jeru, if you find a prescription that contains doxycycline, which is a tetracycline, what will you tell the patient with regards to interaction with milk? Bruce Njeru, unmute and talk to us.
I will advise the patient against taking tetracyclines with milk because it will make the drug it will form complexes which will not be absorbed. So I'll just tell the patient, while you're taking doxycycline, do not drink milk.
Okay, yes, that's correct. And usually, if you look at the interaction between doxycycline and milk, where does this interaction happen? Faith, Kiragu, kindly, everyone who is joining my class, ensure that you join with microphone. You're not allowed to join my class online with listen only. This is not a radio class. This is an online class. So Faith, Kiragu, kindly log out and log back in with microphone so that we can communicate. Francis Gakinya, where does the interaction between doxycycline and milk take place?
Good afternoon.
Good afternoon.
I think the interaction happens in the stomach.
Interaction happens in the stomach. It's important for you to be able to appreciate where is this interaction happening, because this will guide you on how you will actually instruct your patient, okay? Because if this interaction is happening in the stomach, then it means that you can actually tell this patient that so long as there is milk in the stomach and doxycycline comes into the stomach, they will interact, they will form a chelate, the chelate will be removed through the feces, okay? So what you can tell the patient is when they are taking the drug, they can actually avoid taking the milk, okay? So for instance, think about doxycycline. Generally, the dosage for doxycycline, if you have an infection, it is given twice a day. You take it in the morning, you take it in the evening, after every 12 hours, okay? But you will find that this drug will actually, within about 2 hours, majority of the doxycycline has actually been absorbed, okay? So that if the patient wants to take their cup of tea or they want to take their glass of milk, you can actually tell them, ensure that you give a space of up between 2 to 3 hours, okay? So tell them you can take your doxycycline at 7 in the morning, okay? Then after about 3 hours, you can take your milk, because after that, the doxycycline has actually gotten absorbed, okay? Or you can tell them you can have your tea at 7, okay? But wait for at least 3 hours before you take the drug, because by then the milk will have been absorbed. You will not have any interaction in the stomach, okay? So we talked about that, all those interactions that may actually happen, okay? If the patient is asthmatic and you're being given beta blockers, this is something that you may probably have to talk to the doctor and see whether they can actually alter the prescription, because this may be an issue, okay? And this is the point again where you will ask the patient, are you on any other medication? Because you want to find out the medicines they've been prescribed for, okay? Is there a chance that they may actually get a reaction with the ones that they are on at home, okay? So it's important for you to actually take that into consideration. Then we talked about the dose. Ensure that for the indication, for the condition that the patient is being treated, the dose is correct, okay? Check for evidence of harm or benefit. Ensure that that drug is actually not going to cause harm to the patient, okay? For instance, something like you must know thalidomide. Boaz, have you heard of thalidomide? Unmute.
Yes.
Okay, what do you know about thalidomide?
I don't remember where I quite well for now.
Drusilla, what do you know about thalidomide?
Yes. I think it has some threaten. I think it has some effects of some effects on fetus.
Okay, yes. Thalidomide actually has an effect on the fetus. It has teratogenic effect, okay? So based on what Mercy has said, okay, where were we? Faith Kiragu, if you got a prescription having thalidomide, based on that information that Lucilla has given us, what will be your concern with that prescription? Faith Kiragu, unmute and talk to us.
Pardon the question.
Based on the information that Mercy has given us, what would be your concern with that prescription?
I've only just joined. I didn't hear the prescription that was being talked about.
No, you are on the line. I could see. Francis Gavira.
Confirming if the patient is expecting or if they are pregnant.
Yes. Based on that, if you see a prescription that has thalidomide, the first thing you want to see, number one, what is the sex of the patient. Are they male or are they female? And if they are female, are they pregnant? Okay. And even if they are not pregnant, okay, especially if they are of childbearing age. These are things that as you look at it, you want to find out because you understand that this is a drug that would actually harm the patient and the fetus, okay, if it is consumed. So anyway, we looked at all these things. We looked at appropriateness, legal and completeness of the prescription, cost effectiveness. Remember we mentioned with cost effectiveness, you're looking at the cost of the drug vis-a-vis the effectiveness. There is no need to prescribe a drug that the patient cannot afford. You end up having a scenario whereby a patient walks around with a prescription, they are suffering, okay, and yet you could have given them a prescription that they can afford and they would have been helped, okay. So we looked at acceptability, safety, and effectiveness, okay. So that is the second step, okay, clinical and legal check. Then next, after you have confirmed that this prescription is, the dose is correct, you've seen that it is correct for the indication that has been given, you have confirmed that the patient will label each drug individually, okay? Each drug must have the name of the patient, the name of the drug, the dose, the quantity, the instructions on how the drug should be taken. All this must be on each label. We were looking at the prescriptions that we were looking at last week, okay? So if you look at, let me just go back and see if we can find a prescription. Yeah. So for instance, in this case, this is what we mean. You're labeling a prescription for Salome Shalom. Ensure that you have picked these 3 items. You have the gentamicin eye drops, you have the ibuprofen tablets, you have the amitriptyline tablets, okay? What you're going to do, you're going to pick out 3 separate labels, okay? And each of those labels will have the name of the patient, okay? It will have the name of the pharmacy. You can see now the address has changed. Initially, the prescription must have the address and name of the doctor. But now when you're giving the drugs, okay, that prescription label must have the name of the pharmacy. It should have the name of the patient, the name of the drug, and the instructions, okay, on how that drug should be used. So you pick out 3 different instructions, 3 different labels, and each of those labels should have that information. You can see how gentamicin is to be taken is different from how ibuprofen is to be taken, from how amitriptyline is to be taken. Okay, so it's important that you actually take care of all that. Okay. Yes, so you ensure that all those items are actually labeled, okay? The labeling includes all extemporaneously prepared medication, all repackaged medication from the manufacturer's pack, and all manufacturer's patient packs. When we talk about extemporaneous prepared medication, these are usually products that you will prepare in the pharmacy, okay? Everything that leaves the pharmacy must have a label, whether it is a package that you've received medicines and They are packaged in the manufacturer's pack. We'll be looking at some of those packs, and you'll be able to see the manufacturer's pack. Just a minute, let me see if I can. This is a manufacturer's patient pack, okay? You can see this is a drug that has been packaged, produced in the industry and packaged, okay? It comes ready with the right number of tablets that the patient will take, okay? This is enough for 28 days. So you do not give this pack without a label, okay? You must prepare a label and append it onto the manufacturer's patient pack, okay? Then we have extemporaneously prepared medicines. These are basically medicines that were prepared in the pharmacy. You can see like this one, it's written Philippine Children Medical Center. This is a preparation that has been prepared within the pharmacy, okay? And you do not allow it to leave the pharmacy without a label. It must have a label, and we will be looking at what is supposed to be on that label, okay? So please note, nothing leaves the pharmacy without a label. Then the standard requirements for labeling dispensed medicines. It must be legible. Ensure that whatever you're writing is legible so that the patient is able to read. If you dispense something and the patient cannot read it, it's basically useless, okay? You have done yourself a disservice. You have done the patient even a greater disservice, okay? So ensure that whatever you have written, the patient can read it and understand, okay? And we'll be looking at the next step. We'll be looking at, as you're handing out the drugs to the patient, you will explain the instructions that you have written. Explain them verbally. Ensure that whatever you have written is self-explanatory, but also explain it to the patient verbally so that you reinforce what has been written, okay? So important information on the label includes the following: and multiple packs. So indicate on the label whether there are 2 packs, okay? If there are 2 packs, ensure that you tell the patient these are 2 packs of the same medicine. For instance, this is what I mean. Sometimes you may go to the pharmacy and the doctor has written for you drugs for 2 months, okay? And you find that you have been given manufacturer's pack, the pack that I've shown you from the manufacturer, okay? It contains drugs for a full month. So the pharmacist gives you 2 packs of that drug. It's important to tell the patient that these are 2 packs of the same drug. Finish 1 pack before you start the next. I know this sounds very, you assume this is common sense, but we have actually had scenarios where patients have gone home and they pick from each of those packs, meaning they are doubling the dose that they are supposed to take, okay? So always ensure that you indicate this is 1 of 2, this is 2 of 2. Then you explain to the patient, you finish 1 pack and you start on the next. The label should have instructions for use, precautions relating to the use of the product, the patient's name, the date of dispensing, name and address of the pharmacy. This is very important. The statement, keep out of reach of children or similar precaution. This must be on every prescription. Then for external preparations, the statement for external use only, because we've had scenarios where medicines that were meant for external use were actually consumed orally, which can be, it could be quite dangerous. Then the next step, the 4th step, is confirmation of the prescription items. Remember, we have received the prescription, we have legally checked it, we have checked it clinically and legally to ensure that it is as required per law. Then we have collected the items, we have labeled them. Now they are ready for dispensing. But before we call the patient to come and pick their prescription items, we confirm, okay, whether the prescription items are actually what was prescribed, okay? This is usually done to ensure that if there are any mistakes, they can actually be corrected. And ideally, this should be done by a second person, okay? You want, because sometimes if you're in a hurry, you may make a mistake, okay? And if you make a mistake and you are the same one who is confirming, it may still escape you, okay? So the ideal scenario is for one person to receive the prescription and prepare it, and then a second person confirms the prescription, okay, before it is handed over to the patient. So the prepared and well-labeled prescription items are checked by a second person. Ideally, this is done by someone different from whoever prepared the medicines. They check this against the prescription, and this is done so that in case of any mistakes, they can be picked out and corrected before the medicines are handed over to the patient. Then the fifth and final step is handing over the prescribed items to the patients. So it should be ensured that the patients understand how their medicines should be taken. Remember, we said our main aim is to ensure that medicines can be taken safely, okay, for the purpose for which they've been prescribed. If you give a patient a medicine and they are not able to take it safely, then you have done them a disservice, okay? So ensure that the patient actually understands. If you need to use vernacular, use it, okay? Just to ensure there's understanding. The written instructions should be explained verbally and demonstrated where necessary. For instance, if you are you have an inhaler, okay? Don't just write on the inhaler, you know, take 2 puffs and or inhale 2 puffs and that's it. If this is a new patient, you must demonstrate how that is going to happen, okay? A patient who is going to be injecting, for instance, insulin, okay? Or some of these newer, heparins like enoxaparin. If you have a patient who is going to be injecting at home, don't just tell them, go and inject. Remember, we said it is your responsibility to ensure that by the time that patient is leaving your pharmacy, they know how to use all their medicines. They are not going to find some quack to explain to them how to use a medicine, and yet they have left a professional, okay? You went to school for that. You're leaving them to go and find instructions from elsewhere. And as we mentioned, quacks will confidently tell them how to use them. And then they end up coming back to the hospital, ending up in ICU, hospitalized, because you failed to do your duty. So ensure that everything that you're giving the patient, you are sure they know how to actually take it. If it is an injection, like insulin, they know how to administer it. Insulin usually can be injected. The older versions, usually you have a scenario whereby you withdraw the insulin and inject it using a syringe. Currently, there are things like insulin pens, whereby the patient actually is able to just inject, okay? Ensure you tell the patient how to measure the right amount of insulin, okay? Whether they're using the pen or they're using the syringe. Tell them how to measure the correct amount, okay? And again, when to actually inject, okay? Is it as they are eating? Is it 15 minutes after they eat? Ensure you give them all that information. If it is an inhaler, take them through the process of using the inhaler, because we have had scenarios where patients have come to the pharmacy and they have claimed, I've been using this inhaler and it does not work. when you ask them to demonstrate how they use the inhaler, you realize that 3/4 of the medicine escapes into the atmosphere. It does not get into their airway. Because of that, they do not feel the effects of the inhaler. Okay, so I will not continue to emphasize that, but please note, okay, that the written instructions should be explained verbally and demonstrated where necessary. Any precautions should be mentioned to the patient. So if that medication has a caveat to it, okay, for instance, last week we were talking about NSAIDs, and we said generally NSAIDs, you will tell your patients to take them after meals, because there are patients who actually will experience heartburns with that medicine, okay, due to acidity. Okay, so those are some of the things that you need to tell your patient. Or like we had the medicine which makes you drowsy. You need to tell the patient this medication will actually make you drowsy. So if you're a driver, ensure that you're not driving while you're taking this medication. Okay. Any expected side effects should be explained, and ways of managing them explained in case of occurrence. So again, there are some medications that are known to have specific side effects. If you have such a medication, tell the patient that this is something that you could expect. And usually we tell patients, not all side effects that are indicated on a drug will happen to everybody, but we have a small percentage in the population that may actually experience a side effect, okay? So if you're one of those, you tell the patient, this is what you do, what is recommended, okay, for managing that side effect, okay? If there, remember the other time we were talking about rifampicin, of urine. When you're taking rifampicin, when you go to the bathroom, you notice that your urine is actually red, okay? If you don't tell the patient that, they will actually travel back to the hospital, you know, thinking that there's something wrong with probably their bladder or their urinary tract system, okay? So it's important for you to tell them that this drug I'm giving you, okay, it is excreted through the urine, and one of the things you're going to notice when you're taking this drug is that your urine is going to turn red. It doesn't mean that there's anything wrong with your urinary tract system. It just means that the drug has been able to work in the body. It is now being excreted. And when you finish taking the drug, you will notice that the color of your urine will go back to normal. Okay, so that should be communicated. The other thing that should be communicated are storage instructions. You must tell your patient about storage of the drug. Remember, stability of pharmaceutical active ingredients is key. If those drugs are actually not stored well, what is going to happen is that they're actually going to deteriorate. So for instance, think about insulin. Insulin is a drug that if it is not stored in the fridge, it will actually deteriorate with time, okay? So you need to actually tell your patients that this drug should actually be stored in the fridge, okay? Or something like antibiotic powders. There are antibiotic powders that usually for children, okay? They come as a powder, but when you're ready to use, you actually add water to it, okay, to either dissolve or suspend the drug, okay? Then usually they are given as powders because of stability, okay? They should be used within 5 to 7 days, okay? If you extend, the drug deteriorates very fast, okay? You will not have, an active ingredient in that drug. So again, it's important to communicate this to the patient, okay? In case of chronic illnesses, the patient should be informed that they will require to go back to the doctor for review and subsequently refill their medicines. Again, sometimes pharmacists will assume that the patient has been told this, okay? When in real sense, sometimes when you actually talk to the patient, you realize the patient has actually not been told all this information. So usually what I will tell pharmacists is assume you're the only professional this patient is coming into contact with. Ensure you give them all the instructions. You'd rather have them tell you, yes, my doctor told me that, okay? So that you just confirm with them, rather than the patient goes away, because we have also had such scenarios where we have a patient come in, they were diagnosed with a chronic illness, okay? Then they came in, they went back home, they felt better, and they never came back to the hospital, okay? And then the condition got worse, because we know with chronic illnesses, you're basically doing management, okay? So the patient has to continue under management. So please note that it's important, okay, to tell the patient all that, okay? Any questions on that process? Okay, if there are no questions, I want us to look at labeling, which is key, okay? We've alluded to what a label should look like, what it should contain, but there's more information that we need to be clean, secure, and affixed in the correct position. Why are we so insistent on the label? We have had scenarios where children, remember we said the drug, of course, must have the statement, keep out of reach of children. But there have been scenarios where children have actually picked, a bottle of medicine, consumed it, okay? And then when they are taken to hospital, nobody knows what they took because the label was missing or the medicine was not labeled, okay? So it's important. Ensure that every medicine is labeled, especially with the name of the medicine, okay? Information on the label should be legible, concise, adequate, and accurate. Of course, this is what we were looking at, the manufacturer's patient pack, and we have said, even though it has come from the industry package, ensure that you append a label to everything that is leaving your pharmacy. This already we looked at. These are extemporaneously prepared medicines. You can see it has the name of the pharmacy, okay? It has the name of the patient over here. It has the name of the drug plus the strength of the drug, okay? Then it has the date it was prepared, okay? Instructions for use, okay? And the date over here, what you cannot see is the expiry date. So all that information must be there, because remember, with extemporaneously prepared products, usually the expiry date has been brought forward or shortened. The shelf life has been shortened. So it is important you tell the patient how long this medicine will be viable, okay? When is it expiring? Because you've given them this medication, they're taking them for a time. So indicate on the bottle the expiry date of that medicine, okay? Yes, Timothy?
Sorry for interruption. I have a question.
Yes.
For extemporaneous preparations, how do you determine the expiry dates?
Okay. Usually what you will find when generally for extemporaneous preparation, you're not just going to wake up and decide, okay, I'm going to prepare this, okay? Before you actually prepare a medicine extemporaneously, you have to find out, is this drug, for instance, generally most extemporaneous preparations will be done for children. And for the reason that you may find that the drug you want to give the child is actually not available as syrup. For instance, the scenario I was telling you where I worked, where we had a patient who was unresponsive to everything else except ciprofloxacin. And they were a child, and from what we know, fluoroquinolones are generally not given to children because of the side effect we talked about, okay? So, but for that child, it was a matter of we either lose the child or we treat and monitor for the adverse reaction. So what did we do? We decided to treat the child and monitor, okay? And the child actually survived. So when you think about that, we don't have, this is a baby, we don't have the drug, okay, in the form in which the child needs it. That is when we go and decide, okay, let's prepare this into a syrup that the child can get. Before you actually prepare it, you need to find out the stability of your drug, because now we are looking at ciprofloxacin. Go and look at the data online, okay, or in your book of reference. Check what is the stability of ciprofloxacin, okay? When exposed to light, when exposed to moisture, because remember, you're probably going to crush it and add it to a simple syrup, okay? So you want to find out, in contact with water, does it degrade, okay? And if you go online, you will actually find that there are, there is data, okay? There are children's clinic mostly that have developed formularies, okay? And in those formularies, they have actually indicated if you extemporaneously prepare this drug, okay, in simple syrup, okay, or this drug in this base, okay, this is how long the drug will remain viable, okay? If you have a patient who needs, say, sildenafil, okay, the Viagra, because it's generally, it doesn't come as a syrup. It usually will come as tablets. But as we said, remember initially, the reason why Viagra was developed was for pulmonary hypertension. And you will find it used very commonly for children with pulmonary hypertension, okay, or heart issues. Usually what will happen, you will prepare it extemporaneously, crush the tablets, add it to a vehicle, and hand it over with instructions on how to give, okay, based on the prescribed dose. So usually, if you go and look at this, if you take the shelf life will be 60 days, okay? But the basis of that is the stability of the drug. They're looking at this drug, how does it interact with air? Does it interact with water? Okay. And when you expose it to water, how long does it take for it to deteriorate beyond the required quantity? Okay. So you can actually go online today and look at some of these extemporaneously prepared formularies. Just Google extemporaneously prepared pediatric formularies. You will see a lot of them, and usually these have been tested in the lab, okay? Where you actually prepare a drug in a liquid form, then you test it daily, okay? After a certain period of time, to test and see how long does it take for that drug to deteriorate beyond a useful quantity, okay? So that information is there, okay? Does that answer your question?
Yes, thank you.
Okay, so we were saying all prescription items must come with a label, okay? You have the manufacturer's patient pack, it must be labeled. Extemporaneously prepared products, they must be labeled. Repackaged medication. Usually, you will find sometimes medicine will come in a big tin, okay? Maybe it contains 1,000 tablets and your patient only needs 20, okay? So you will count 20, repackage them into a smaller container. What we are saying is that that smaller container must have a label. It should have a label containing all those things that we have talked about, okay? Again, this manufacturer's bulk pack, okay? This is what we are saying. Your medicines could come like this one, probably contains 50 tablets. Maybe your patient only needs 10, okay? So you package them in another bottle, you must label it. So what are the functions of a label? It is for identity, to identify the contents of the container. Remember, as I mentioned, we've had scenarios whereby a child has consumed something and we don't know what it is, okay? Which is very hard to treat because remember, if someone has consumed a poison, the management will be largely determined by what has been consumed, okay? If I remember management of poisoning, hopefully you did this in high school or primary, okay? There were different ways different poisons would be managed. There are times you'd be told, this one you can induce poisoning, with this particular one you should not induce poisoning, and things like that, okay? So that's what we are talking about here. Always ensure the identity of the contents is on the container. So functions of a label: identify contents of the container, provide clear, concise information which will enable the patient to use the medicines effectively and appropriately. Identify the patient for whom the medicine is dispensed. Remember, we said it should have the name of the patient. Satisfy legal requirements. It is a legal requirement that whatever leaves your pharmacy is labeled. Okay? Remember, we said sometimes people get away with what is happening currently because the populace is not informed, okay? But as people get more informed, if you play around with the safety of the population, you might get someone who might actually sue you for you neglecting to do your required professional duty, okay? And next, to indicate how the product is to be stored and for how long, to indicate clearly to the patient any warnings and cautions of which they need to be made aware of. Okay. Then there are standard details required on a medicine label. However, some medicines may require additional details. Okay. In addition to the label on the medicine, it is important to give verbal advice and counseling to the patient. We've already talked about that. Always ensure that the patient understands what has been written and give them a chance to ask questions to confirm what has been written, okay? This is the same slide that we had looked at on the standard requirements for labeling dispensed medicines. And we have said that it should contain the name of the preparation, the strength and form. It should contain the quantity and multiple, indicate whether there are multiple packs. Excuse me a bit. Okay, sorry about that. instructions for use, precautions relating to the use of the product, patient's name, date of dispensing, name and address of the pharmacy, statement, keep out of reach of children, and also the statement for external use only if you are dispensing external preparations. Then we also have additional labeling. There are some medicines that may not require additional instructions, but there are some medicines that will require additional labeling, okay? So for instance, warning or advisory labels should be attached to the container where appropriate. So you may have, say, a drug that may actually cause drowsiness. This is a drug that you would want to actually tell the patient so that if they are operating machinery or if they are driving or if they perform duties that require them to be alert, then you need to tell them so that probably they need to get an off day from work, because you don't want a scenario whereby, say, a patient works in the industry and the next thing you hear, they fell into the equipment because they were drowsy, okay? Or they slept on the road because they were drowsy. So it's important. Warning or advisory labels should be attached depending on the drug. Then the batch number, this is important for extemporaneously prepared products. When you have products that are prepared extemporaneously, usually for traceability, it's important for them to have a batch number, okay? Or a way of identifying so that you can actually tell this is a product that has been produced in your pharmacy and this is when it was produced, and you can trace, okay? In case of anything, you can actually trace all that. Usually, products that are produced in the industry will have a batch number, okay? And that batch number is a legal requirement. It is important for tracing, okay? Now, in your pharmacy, you need to be able to give a batch number to your extemporaneously prepared products, because you need to be able to trace. You don't want a scenario whereby your product has no date of production, you don't even know when it was produced, you do not know what material was used, so that in case of an issue, you cannot trace anything, okay? That is professional misconduct. Ensure for the safety of the patient, you can actually trace your product, you can trace what raw material was used to prepare that product, you can trace who prepared it, and you can trace when it was prepared. Then an expiry date. This is again important for extemporaneously prepared products, because remember, products that come from the industry, the tablets, the syrups, those powders, they will come with a shelf life. But now, when you manipulate them in the pharmacy, generally the shelf life becomes shortened, okay? For instance, for the case of dilution. So you need to indicate on the package the expiry date, okay? And then again, think about eye drops, okay? Usually eye drops will have an expiry date. Okay, for instance, if you go today to buy an eye drop, you may find that the eye drop has been indicated. It expires in maybe June 2027. Okay, but one of the things you need to note is eye drops are usually sterile. They should not contain any microorganisms. And usually what the manufacturer will say, once opened, it should be used within a month. Okay, because that is the period the manufacturer can assure you that this product will remain viable and it will not be, it will remain free of contamination. If you go beyond 1 month, you may actually use a contaminated product, okay? So as much as on the label, or rather on the packet, it has been written expiring 2027. But because we opened it today, it will only be viable until January 10th, okay, within the month. So for eye drops, after you open them, you use them within 1 month and discard, okay? And usually it's because of that contamination issue, So again, it's important to indicate that. If it is the eye drop, indicate use within 1 month after opening. Okay. Then things like vet products indicate for animal use only or for animal treatment only. And then indicate storage conditions. Remember we said there are some products that need to be stored in the fridge. Indicate that this product should be stored in the fridge, and also verbally communicate to the patient. Okay. So when you talk about the name of the preparation, we are now looking at the label. When you talk about the name of preparation, form, and strength, the name on the label should be the name on the prescription. For example, if generically prescribed and it's available as a brand, the name on the label should be the generic. The name is omitted only if it is a prescriber's preparation or formula containing several active ingredients, hence has no official name. So sometimes you will find, for instance, for dermatology products, you will find that the prescriber has told you take hydrocortisone 1%, to eat, add salicylic acid, then dilute it in, ointment. Okay, so that now at the end of it, you have several active ingredients in that, okay, diluted in ointment for application. It has no name, okay? So for that one, you do not have to indicate the name of the preparation. However, you must indicate what is contained in that preparation, okay? So indicate that this preparation contains salicylic acid, indicate the percentage. This preparation contains hydrocortisone cream percentage, and indicate it contains ointment, this amount, okay? So every product must have the name. If it is one prepared in the pharmacy, indicate the formula, okay? What does it contain? Okay. If the preparation is available as more than one strength, for example, amoxicillin, usually you will find amoxicillin capsules containing 500 milligrams. You will find capsules containing 250 milligrams. You will find syrups containing 125 milligrams per 5 ml. So the strength must be included. So for instance, you indicate amoxicillin capsules 500 milligrams. That must be included on the label, okay? And the form should be included, especially if available in many forms. So for instance, you may find there are drugs that will come as capsules, others will come as tablets, others will come as syrup, others will come as solution, okay? So indicate, okay, the form. Then quantity and multiple packs, as we've alluded to, the prescribed quantity should appear on the label. If the medicines are in a manufacturer's patient pack, e.g. ARVs, which may come as packs of 30s or 60s, when supplying more than one pack, then each pack should have a label and the quantity in it. It should then be labeled to show the patient which pack to start with, okay? So you have, say, if you are giving a patient drugs for 2 months, okay? You have one pack containing 30, another pack containing 30. You're giving them both to the patient. What we are saying, each of those packs should have a label, and you indicate on one, pack 1 and pack 2, okay? So 1 of 2 and 2 of 2, and then instruct the patient. Talk to the patient and tell them that these are the same drugs. You finish one before you start the other. Okay, otherwise you may have a scenario like what I mentioned, where you have a patient who went and took both drugs at the same time, and yet they contained the same active ingredient. They end up overdosing. Okay. Then instructions for use: the patient must be told how much to take, how to take, when to take, and how often to take. Okay. So how much to take? For instance, take 2 tablets, okay? How to take? Either they are going to take it orally or they are going to instill it, maybe in the eye or in the ear, okay? Or they are going to insert it, okay? Maybe intravaginally or, intraanally, okay? Or they are going to apply it topically on the skin. Okay, you get the difference. I hope you're able to appreciate what I'm driving at here. Okay, when we say how to take, okay, it's generally refers to the route of administration. Is it orally? Okay, is it intranasal? Is it into the ears? Is it into the eyes? Is it being inserted? All that you must indicate on the label, okay? Then when to take, are they taking it in the morning? Are they taking it in the evening? Okay. How much are they taking? Okay. Are they taking it once a day? Are they taking it twice a day? Are they taking it once a week? Or are they taking it once a month? You will come across drugs that are taken once a week, drugs that are taken once a month. As I mentioned in class, whenever you come across a prescription that is not the usual prescription, patients are used to prescriptions that they take daily. When you come across a unique prescription where they have to take weekly or bi-weekly or monthly, you must stress the instructions. You must tell the patient and repeat it so that by the time they're leaving the pharmacy, they are in no doubt that you did not make a mistake. Because as we mentioned, when the patient thinks you made a mistake, they will go to get instructions and woe unto them because they don't know the person behind the pharmacy they are entering, whether that person is a real pharmacist or technologist or they are a fake, okay? So as we said, do not allow the patient to leave your pharmacy in doubt. When you're giving them a drug that they have to take weekly, tell them, I have not made a mistake. This drug is not like the others. This drug, usually the others you will take daily, but this one you take weekly if you'll overdose. So for that reason, the doctor has not made a mistake. I have not made a mistake. We want you to take this drug once a week only. When you take Monday, the next time you're going to take the next one is Monday next week. Stress it so much so that by the time the patient is leaving the pharmacy, they are in no doubt as to your instructions, okay? It's important to ensure that the wording on the label is clear, concise, and comprehensible to the patient, okay? If prescriber's instructions are missing, the pharmacist must obtain instruction from the prescriber or use professional discretion to interpret the instructions from reference sources such as the BNF, okay? Wording is important. Active verbs are used, okay? For example, take instead of to be taken, apply instead of to be applied, okay? So for instance, when we say we are writing instructions for the ibuprofen, okay? Instead of saying 2 tablets to be taken 3 times a day, what we are saying is just indicate, take 2 tablets 3 times a day, every 8 hours, okay? We are saying apply, okay? Apply this to the affected areas twice a day, okay? According to research, active verbs are easily remembered than passive verbs, okay? Then avoid 2 numbers following each other. For example, avoid writing take 2, 3 times a day, okay? Because hopefully you have experienced that your eyes can actually change this, okay? You read something and your head tells you, I actually read 3, 2, okay? So because of that, usually we say separate the numbers with the formulation name, okay? Avoid saying, take 2 3 times a day. It can end up being 3 2 times a day. What you do instead is separate the numbers with the formulation name. For example, take 2 tablets. What the patient walks away with is 2 tablets, okay? They are not confused. So take 2 tablets 3 times a day. Don't write take 2 3 times a day, okay? Numbers in the instructions must be written as words, except in case of measurements, 5 ml, 2.5 ml, and things like that. One of you was had mentioned last week 2 times 3, 3 times 3. That is malpractice, okay? It's something that people have just, adopted, but it is, I don't expect my students to do that. If you write that in your exam, you will fail that question. Okay, but currently, usually you will find labels have already been pre-written. So you don't have, you basically just have to fill in. You have a label that has been printed. So you just fill in the name of the patient and you write how they're supposed to take it. Okay, so usually that is even easier. Then liquid preparations for internal use should usually have their dose expressed as a certain number of normal unit provided to the patient to measure. So their dose, e.g., take 2 5 ml teaspoons 3 times a day. Okay, so you can write that, or you can write take 10 ml 3 times a day, so long as you explain to the patient that this measure, okay, is 5 ml, okay, so that you're able to, the patient can know that this 2 5 ml makes 10, okay. Never use the word take on the preparation that is not intended for oral route. Generally, I hope by now you're able to appreciate when you tell the patient take, assumption is you want them to consume it orally. So if the preparation is not for oral, then do not use the word take. The word take has been reserved for oral preparations, okay? You can use the word give as a dosage instruction on products for children, as a responsible adult should administer them. But again, the same can still be, you can use give, but you can also just indicate take. The assumption is that the responsible adult understands that that is for the child because the name of the child is there. Only use numerals or numbers when quoting the number of millimeters to be given or taken. All other dosage instructions should use words in preference to numerals. Always be prepared to give the patient a verbal explanation of the label. The reason why we want to try to avoid numbers is we have scenarios where someone, probably the eyesight is not okay, or some people, the way they write a 3 and you're not sure whether it's 3 or it's 5 or it's 8. Okay, they write a 2 and you're not sure whether it's 2 or 7 or 9. Okay, so you want to avoid such. Precautions relating to the use of the product, this is important for safety. Okay, includes things like flammable, if a product is flammable, so that it can be kept away from fire, not to be consumed by mouth. Okay, for external use only. Those are labels relating to, or rather precautions. Okay, Then the patient name, this is a legal requirement. The patient name must appear on the label of all dispensed medications. The date, name, and address of the pharmacy, again, this is a legal requirement. It's important since it shows the source of the medicine and the date of dispensing. In case of an overdose or poisoning, the label assists in the investigations. We had already talked about that. The statement, keep out of reach of children. It's important to prevent accidental ingestion by children. All dispensed medicines must carry this label. Again, auxiliary labels, these are important for medicines requiring additional labeling, such as avoid alcohol or take after meals. So there are medicines that, as we mentioned, the instructions on how to take, but probably due to side effects or due to interactions, you want to give additional labeling to ensure that the drug can be taken in safety. This is what we are referring to as auxiliary labels. And examples are things like avoid alcohol or take after meals. Then we have storage instructions. Generally, medicines will be stored in a cool, dry place. However, some medicines may require specialized storage conditions to enhance stability. For example, refrigeration. When we talk about store in the fridge, remember, this is 2 to 8 degrees. Unless you have specifically been told a product should be frozen, never store medicines in the freezer. Storage in the fridge implies 2 to 8 degrees, or refrigeration implies 2 to 8 degrees. When storage in the freezer is expected, it is specified implicitly. Okay, it will be indicated that it should be stored in the freezer, and the temperature usually will be indicated, okay, as negative, you know, whether it's negative 10 degrees, negative 20 degrees, like negative 70 degrees, like was the case with the COVID vaccines, okay? So generally, for pharmaceuticals, when we talk about refrigeration, 2 to 8 degrees, okay? Or again, store in a cool, dark place. Batch number, as we mentioned, for extemporaneously prepared products, the details of the ingredients should be included and it should be given a batch number. So remember we said sometimes for extemporaneously prepared products, you add several ingredients to a vehicle, okay? Now that mixture may not have a standard name. So you may not have a name to indicate, but what you will indicate, you will basically write this preparation contains the following. You indicate those ingredients plus the strength, okay? The batch number allows for the tracing or referral back to this information. Usually there should be a record in the pharmacy of the products that have been extemporaneously prepared in the pharmacy for quality control purposes. Then we have the expiry date. This must be put on any extemporaneously prepared product. It should also be put on a product if the product has been diluted, thereby affecting its stability and shelf life. If you have a scenario whereby, for instance, you are preparing, diluting an antibiotic powder, or rather not diluting, reconstituting, okay? What is happening is you interfere with the shelf life that the manufacturer had put, because when that bottle leaves the industry, it comes as a dry powder, and the manufacturer, again, just the way we mentioned about the eye drops, the manufacturer will indicate that the expiry date of this powder is 2027, okay? But you know that before this powder is used, you add water, okay, so that it becomes a suspension that can be administered to a baby, okay? So usually what the manufacturer will tell you is from the date of reconstitution, this product is only viable for 5 days, okay? So now it is your responsibility as the pharmacist to communicate this to the patient, okay? Tell them that after reconstitution, this product is viable for only 5 days and it should be discarded after the 5 days. So indicate to them the day preparation is sterile. For instance, eye drops, we mentioned this. Once opened, the product is no longer sterile, and if used beyond a certain time scale, there is a serious risk of infection. Okay. So for instance, eye drops and ointments, once opened, should be discarded after 4 weeks. This is usually the manufacturer's recommendation. Expiry dates are expressed as below. Any unused eye drops to be discarded on date, then you indicate the date. Or do not use after date, then you indicate the date. I hope that is clear. Okay, so again, this is just an example of what you would use as a label. Okay, you can see we have the name of the pharmacy. We said this is a legal requirement. Okay, we have the address of the pharmacy. These ones, probably this is a system generated label. It has the doctor's name here, but this is not a legal requirement, okay? But if you have a system generated label, this is probably just the system puts it there and it's not an issue, but it may not be legally required. But the name of the pharmacy and address, legal requirement. Name of the patient, that's a legal requirement, okay? Then you have instructions on how the drug should be taken here, okay? Like this, you can see this is what we were talking about, okay? This tablet, okay? What did we say? What is wrong with this prescription? Where were we? Brimstone. What is wrong with this prescription? Unmute. The instructions. What is wrong with the instructions? Unmute and talk to us. Okay, Julius. What is wrong with this, the instructions? What did you say? What did we say about 2? Yes, Bruce?
It will be written in words, the 2.
Okay. Okay, that's actually this sorry, I'm confusing this. This is not what I was looking at, because the main, but as you have, okay, that's fine. As you have mentioned, the 2 ideally should be written in words, okay? But the most important is this, okay? This should actually be written in words so that you don't get an issue with patients making mistakes, okay? Again, we have another label here. You can see the name of the pharmacy, the name of the patient, the name of the drug plus the strength, how the patient is supposed to take it, okay? So that is another label. Patient, Jane Smith. Pharmacy, it's not visible there, but you can see there is a name of the pharmacy. You have Zopalin, 50 milligram tablets. You have take 2 tablets twice a day. Then you have the quantity over there, okay? Again, this may be probably a system-generated label, so that now it gives you the prescription number, okay? And you can see it has an expiry date, okay? Now, we've talked about auxiliary prescriptions. Those are the additional information that you add on the prescription to enhance safety of use of the drug, okay? We'll be looking at that, okay? So as we've said, your prescription should have the name and address of the pharmacy, like here we have Bidwell, okay? We said this prescriber's name is not a legal requirement, okay? But if your system is able to generate, again, you better have more information than less information. The date of filling, okay? The prescription number, patient's name. This is important. It's a legal requirement. The name of the drug, okay? Here, this one has been put down here, okay? The medication, name, strength, and dosage form, okay? The quantity, okay? Then directions for use. Again, we said this is a system-generated prescription, so it even indicates refills that are left, so that this patient can actually come back for refill, and you can see that it was indicated on the label, okay? Now, this is your standard prescription, but you may get drugs where you need to have additional labeling, okay? For instance, we talked about alcohol, okay? So that is what we are referring to as auxiliary labels. Like this one, they've indicated avoid consuming grapefruit or grapefruit juice while on this medication, okay? And they've indicated additional instruction, consult your pharmacist or doctor about using this medication if you're pregnant or plan to become pregnant, okay? So that is the auxiliary instruction that we are talking about. Auxiliary labels would contain basically any additional instructions that you need to add to facilitate use of the drug, okay? So do not crush or chew, that is an auxiliary label. Special handling and disposal required, ask your pharmacist. Sometimes you have patients, they have drugs that needs to be disposed of, okay? It's important to tell them that this drug should not be disposed of. For instance, a patient may be, say, on anti-cancers or things that may be harmful. They should be told the drug should not cover, they need to bring them back to the pharmacy so that the pharmacist can dispose of the drugs. And if you go to PPB, you will find that there are regulations for drug disposal, okay? Then things like take on an empty stomach at least half an hour before meals and at bedtime, okay? Or this medicine may cause drowsiness and may increase effects of alcohol. If affected, do not drink, do not drive or operate machines, okay? Those are auxiliary labels, okay? Then for extemporaneously prepared products, we've mentioned the things that need to be there, okay? But this is just an example. You have the name of the patient, okay? This one, what has been omitted here? Where were we? Tobacco. What has been omitted here? If you look at this, we have the patient name, the medicine, the strength, instructions, date of dispensing, quantity. Can you notice anything missing? Anything that is a legal requirement? Anybody notice what is missing?
The name of the pharmacy.
The name of the pharmacy, yes, okay? So the name of the pharmacy is missing here. So, But the rest, you can see this, the name of the patient, okay, which is a legal requirement. The name of the pharmacy should be there. It's a legal requirement. The medicine, you can see the name of the medicine. This is nitrofurantoin preparation. Usually you will not find pediatric preparations containing nitrofurantoin, okay? So you've been told it's nitrofurantoin preparation in simple syrup, okay? What is the strength? Every 5 ml contains 10 milligrams, okay? This baby probably needs to take 10 milligrams. That's why they've been told take 5 ml 4 times a day for 10 days, okay? Discard any remaining amount after 10 days. Date of dispensing, there. Quantity dispensed, 200 ml, okay? Any questions up to that point? Okay, now as we can look at how would you dispense special preparations, syrups, are there any specific instructions that you need to look at when dispensing syrups, tablets, topical creams? Okay, suppositories, pessaries, eye drops, injectables, inhalers. Yes, Timothy.
Okay, yes, I have a question.
Yes.
Based on the instructions that you give the patient, what if the patient is, let's say, blind?
Okay, what do you know about blind people?
We have some who have assistants, the people who can assist them, but there are some who they just come like that with their, yeah, that's some kind of stick that they use. So to such a patient, how would you, for example, if those auxiliary instructions that you put on the label, how would you explain to them?
Okay, let's float it to the class. What do you know about blind patients that would help you during dispensing? Class? Is there any aspect of a patient who presents to the pharmacy and they are blind? Is there anything you know about this group of patients that you can take advantage of during your dispensing? Nobody knows anything about blind people who are blind.
I'm thinking braille machine.
Yes?
Braille machine.
Yes, if you have a chance to actually have a braille machine in your pharmacy that can write braille instructions, that would be superb. But what else would you use? Suppose you don't have a braille machine, because that is actually something that would be quite useful. If you could do that, it would be very useful for clients like that. But suppose you're just in a normal pharmacy and a blind patient, how do we handle it? Anybody?
Maybe if they are blind and they can hear, you can take advantage of the fact that they can hear, and you can explain to them clearly about the prescription.
Okay, what you okay, let's hear from Samuel. Yes.
Okay, I'd say that the blind people normally have heightened senses other than just like the sense of sight. So okay, they'll be paying more attention to things like the sense of touch. So I'd say that I'd give them different medications and then tell them that this particular medication will be in this type of bottle, and then this type of medication will be in this other bottle.
Yes,
Which are,
good. Good. Francis, you have something to add? Gakinya,
Okay.
yes.
I was thinking that in most cases you find that blind people are accompanied by people, especially relatives who accompany them, and you can take advantage of those people who are accompanying them or taking care of them.
Okay.
That is what
Yes.
I was thinking.
Yes. That is true. Both your contributions are true. Usually you will find a patient who is blind generally will come with somebody, okay? But remember, you also want to ensure that even when this patient is alone, they can actually be able to take their drug, okay? But the most important thing you must do, always ensure that the instructions that are written are very clear and concise, because this patient may actually be relying on somebody else at home to read the instructions and pass them the drug. So ensure the instructions are clear and self-explanatory, okay? But most importantly, as was mentioned by Simiu, that most patients who are blind have a heightened sense of touch, okay? Take advantage of that. As you're taking, when a patient comes to you and you can see this patient is blind, find out from them. Remember we said, don't just pass out drugs as though they are groundnuts, okay? Converse with the patient, find out, did you come alone or did you come with somebody, okay? And talk to them, find out, tell them, I have 4 drugs here. How do you want us to handle this? Because I want to ensure that you go home when we have understood each other, okay? So that he can tell you that usually I am able, if you explain to me and you allow me to touch the drugs, usually I'll be able to. Or some of them will tell you, just make sure you have written all the instructions, okay? So that my caregiver can actually assist me, okay? But if somebody is alone, tell them I have written the instructions, but I just want to know that we have 2 drugs over here. You can fill this one. This one contains capsules. I want you to be taking this number of times a day, okay? And this other one, this is a syrup. I want you to be taking this. You know, that is what I want you to do. Converse with your patient. Sometimes you may actually assume that I cannot help this patient, but the patient themselves will actually a good aspect. And you need to think about all these things when you're dispensing to special populations. We have patients we have children, we have patients who are blind, some patients are deaf, okay? Or some of them are dumb. For those ones, what would you do with a deaf or dumb patient? How would you handle that? Okay, hopefully the patient can read. If they can read, that right for them and, you know, find out if they have understood what you're saying. Okay, so I want you to look at these preparations, okay? How do you write the instructions for syrups? How do you write instructions for tablets, okay? These are oral products, okay? Then topical creams, how do you write the instructions? Then look at suppositories, okay? What are suppositories? Look at what suppositories are. How do you dispense suppositories? How do you write the instructions? Because remember we said take is only for oral products. So don't write on a suppository take. And as we mentioned at the beginning of the class, when we come back next year, each of you will get assigned a drug, okay, that you will do the prescription and do the labels, okay, and dispense in class, okay? So find out, how do you do suppositories? How do you do pessaries? What are pessaries? Where are they administered? And how do you write the instructions? Eye drops, how do you write the instructions? And how do you instruct the patient? Injectables, how do you handle that? Inhalers, how do you handle that? Okay. Of course, we've already alluded to this. How do you dispense to children? How do you dispense to the blind, the deaf, the aged? How do you dispense to someone who is mentally challenged? These are aspects that you need to actually consider. Okay. And then I want you to go and look at why should usually a prescription is preserved. It is a legal requirement that you preserve a copy of the prescription, okay, if it is prescription only medicine. But if it is narcotic or psychotropics, as we mentioned last week, you preserve the original prescription, okay. For how long should the prescription be stored? Okay. Again, I want you to find out, according to the Kenyan system, how long do they store the prescription and why do they store the prescription? Okay. Then we have some dispensing tools that you will find in the pharmacy. You have things like spatulas and scoops for handling powders and creams. You have tablet counters. You have such as triangular trays or leaf counters for counting pills quickly. Usually, you don't want to touch the tablets. So usually you have a tray where you can actually count the tablets and fill them into different containers. Then you have graduated cylinders, syringes, pipettes for measuring and dispensing liquids accurately. You have medicine spoons and pots for a patient who needs a lower dose than what is contained in a tablet that is available. You may need to cut that tablet, okay? So you have pill cutters and crushers. But before you cut any tablet, always make sure that it's a tablet that you're allowed to cut. There are some tablets that are meant to be swallowed whole. Usually you'll be told, do not break the tablet, okay? Especially if it's a tablet that contains, say, something like an enteric coating, okay? Or it is a sustained release tablet. Usually you don't want to crush that. Then you have suppository molds for creating suppositories and pessaries. This is rare, okay? In our scenario, we rarely do extemporaneous preparations in the pharmacy for suppositories, but this is something that is possible, okay? So this is a tablet counter, okay? You can see this one is grooved so that you don't have, if it's capsules, they are not rolling all over the place. So you can actually, you have this that you use to move the tablets, then you count them and pour them into whatever container you need. Then we have automated and advanced equipment, again used as dispensing tools. Automated pill dispensers, these are used to organize and dispense medications at scheduled times. We have automated liquid dispensers. These are high-speed, precise liquid dosing for precise liquid dosing. Then we have barcode scanners, which are used with software for inventory and accuracy. We have labeling machines that are used for labeling medicines. For instance, they print prescription labels like what we've been looking at, okay? You've seen most of the labels we were looking at are actually printed, okay? And the good thing with printed labels, they have automatic it's the system automatically fills. So automatically it gives you the name of the pharmacy. Because you're downloading this information from a prescription, it will not allow you to print until you have put every required information. So you have to put the name of the doctor, the name of the patient, the drug, the strength, the number, the instructions on how to use. After you've indicated all those, that's when the system allows you to print. Okay. Then automated storage and retrieval systems store, and these usually will store and retrieve medications efficiently. Online, I think it's China that currently has automated pharmacy systems where you fill in the requirements for the prescription, and they basically use robots, okay, to retrieve prescriptions, to retrieve the items. You generate the label, and it brings everything to the dispensing area for dispensing, okay? Then we also have software that are used for dispensing, okay? We have electronic dispensing tools, whereby you have a system. This is especially good for chronic illnesses, okay? Such as like when they were trying to streamline HIV treatment, they used a lot of this electronic dispensing tool, so that when the patient comes, you can actually see this patient has been taking ARVs for 2 years. They started on this regimen. We changed to this regimen, and they give you the reason why. You can see the patient has been consistent. If they miss, you can actually see the patient did not take the drugs as required, okay? So again, those are electronic dispensing tools. All these tools are actually in the pharmacy to facilitate safe dispensing to the patient. Okay? Again, that is just the same information. Any questions? Up to that point, any question? Okay.
I have a question.
Yes.
Yes, for refills, we have these automated systems. So what happens when the exact...
Sorry, I did not get. For refills, we have?
Okay, for refills, where we are using these automated systems for patients who are on a particular dosage regimen, what happens when the particular drug or molecule is maybe out of stock? How do you handle such a situation?
Well, now, of course, the system will not be able to dispense the drug, because like what would happen when we are working with the ARVs for HIV treatment, you would have to change. If a patient was on one regimen and for some reason that regimen is not available, remember your aim is to ensure that the viral load for this patient is controlled throughout. So you don't want a scenario whereby the patient goes home without the medicine, okay? So if the patient comes to the pharmacy and you realize this regimen has not been supplied, you obviously will have to recommend a change of regimen, okay? Call their attending physician and tell them that the regimen the patient was on is not available. This is what is available. Recommend what would be best compatible with that patient, okay? So as we say, systems are only there to facilitate your working well, okay? Not to hinder you. Because remember, the main aim for using the system is to facilitate, okay, patient care. So if we get to a point and the system cannot help us, we have to have a way of bypassing the system to ensure that the patient gets the care. Because remember, if the patient does not get the drugs, they will actually, we will have consequences, okay? Because then the viral load will become deranged. We will now have a patient that is affected. Okay, does that answer your question?
Yes, it does very well. Thank you.
Okay. So we have a few minutes. I want us to introduce packaging. We've been saying that when a patient is leaving the pharmacy, you need to ensure that each of their medication is labeled, okay? But aside from that, ensure that the package you have used for the medicine is actually suitable, okay? For instance, I believe we talked about this. When you see a medicine that is stored in an amber bottle, those bottles that are usually brown, okay? What does that tell you? If you get, yes, Timothy?
It tells you that that particular medicine has to be stored away from light, direct sunlight.
Yes. So generally, when you look at a medicine, it should tell you something. The packaging should actually communicate something. Okay. If you look at an amber, if you get a bulk medicine maybe that is coming in a 500 ml bottle, or maybe a 5-liter bottle. Okay. When you look at that medicine, the storage or the packaging material should communicate something to you, so that by the time you're actually dispensing this medicine to your patient, because probably you're only going to give your patient 500 or rather 100 ml or 50 ml, okay? You need to ensure that the instructions, or rather the recommendations of storage, okay, or packaging are also maintained by you. Okay, so it's important for you to do that. So the next thing we'll be looking at is packaging. What does packaging involve, and why is it important for us to consider packaging? Because remember, the medicine is only useful if it is stable. If it deteriorates, for instance, when you think about, we've been talking about antibiotic powders, okay? And we've said antibiotic powders are stable, okay? So long as you've not reconstituted them, you've not added water, okay? If you don't add water, they will last for the full shelf life. They will go up to the 2 years that the manufacturer recommended. But when you add water, okay, and you store them at room temperature, they will only be viable for 5 to 7 days. If a patient uses them on the 10th day, you find that the antibiotic in that product has deteriorated. It is no longer there, okay? It has broken down. Activity is no longer in the product, okay? So that's what I'm saying, that when you look at the recommendations of the manufacturer, they should be able to communicate something. When you see a manufacturer giving you powder for reconstitution instead of syrup that has already been reconstituted, as a student of pharmacy, that should communicate something. It tells you that this product is actually unstable in liquid. And once we put liquid, we use it and discard the rest. If a manufacturer tells you this product should be stored in the fridge, what that tells you is that this product will deteriorate at higher temperatures. When you keep it in the fridge, it is maintained as required. Okay, so it's important. Anyway, we're talking about packaging. Packaging is a collection of different components such as bottle, vials, closure cap, ampule, blister box, which surround the pharmaceutical product from the time of production until its use. A container for pharmaceutical use is an article which contains or is intended to contain a pharmaceutical product. It may or may not be in direct contact with the pharmaceutical product. The closure system is part of the container. Now, why are we? First statement, packaging is the collection of different components. We've talked about the bottle, the vial, the closure, and the cap, okay? these are in contact with the product. So like here, all these are packaging. This bottle is a package, is part of the package. This closure cap for this vial, this is the closure for this vial. Okay, if you've been to hospital, if you've gotten an injection, usually you will find that they will take as a needle, insert it here, withdraw the drug and inject you. This is what we call a vial. It has this rubber, okay, and this metal ring that is part of the packaging. This bottle, you have the bottle, you also have this cap. Why do we insist that the closure cap or the closure system is part of the packaging? The reason we insist is because sometimes, especially when you're carrying out, next semester we'll be looking at drug development, okay? When you're carrying out drug development, usually you want to pick a packaging that is suitable for your product. If your product is sensitive to light, you want to pick this kind of, this is what we are calling amber colored bottle. This brown bottle is what is referred to as the amber colored bottle. You pick this bottle because it does not allow UV light to enter and destroy your product, okay? So during drug development, you study your product to see the stability. Is it sensitive to light? Is it sensitive to moisture? Is it sensitive to oxygen? So that by the time you're picking your packaging, you can actually pick a package that will protect your product, okay? Now, in some scenarios, when you're picking packaging, sometimes you find that your active ingredient starts reacting with the package. Remember, the drug that you're using is a chemical. In itself, it is a chemical, okay? So sometimes you pick a package and you realize that the drug reacts with the packaging material. It can react with glass, or it reacts with plastic, or it reacts with rubber, okay? What was found is that because this rubber is in contact with the drug, okay, it's important to ensure that not only the bottle is compatible with the drug, but also the cap, the closure cap, should also be compatible with the bottle or the drug, okay? Because if you only take care of the bottle, what is going to happen is during storage, you end up with interaction between the cap and the drug ends up deteriorating. So for that reason, packaging does not only include the bottle, it also includes, I hope that is clear. Then, okay, and it includes the external box. And we are going to look at the different types of packaging, and you'll be able to see where each of these falls. So the container is designed to allow ease of removal of the contents, facilitating administration, for example, an inhaler or a collapsible tube. You see, the inhaler will contain the drug to be inhaled, okay? But the inhaler serves a role. It serves a role in facilitating inhalation of that drug, okay? There's a reason why the inhaler was not just poured into some bottle, okay? It was actually put in a container that is able to, break that drug into droplets, and those droplets can be inhaled into the lungs, okay? So that's why we are saying the container is designed to facilitate administration. The public may consider packaging to be superfluous and in some cases may even be more costly compared to the medicine itself. Now, there are cases where you will find, if you ask the manufacturer how much a drug costs, they will tell you probably the drug costs like 10% of the cost of that medicine, okay? The container may cost 90%. Okay. So that if you're looking at somebody, they are wondering, why is the container costing much more? But when you think about it, think of an inhaler, for example. Okay. In what form do you need the drug to be if you give the patient a drug for inhalation? What form of the drug do you need? What form do you need the drug to be for it to be inhaled? If you give it to the patient as a liquid, can you get the patient inhaling it in adequate amount? Probably not. Okay. You need a device that will be able to, you will be able to put the drug inside, and then the drug will be able to spray that drug, okay, and allow the drug to be atomized, okay? And then that atomization allows the patient now to inhale that drug, okay? If you're not able to generate that atomized spray, you will not be able to get this drug getting into the lungs. Okay, so you may find that the drug in the inhaler, the drug itself costs very little, but the device costs a lot. Okay, so for instance, let me just share my screen. I want you to look at this picture. Okay. Boaz, can you see my screen? Has the screen changed? Okay. Timothy, can you see the screen? Has it changed?
Yes, yes.
You can see a device on the screen.
Yes, I can see a device on the screen.
Yes, thank you. So you can see this is an inhaler, okay? This inhaler is supposed to generate this atomized product so that it can actually penetrate into the lungs. Hopefully during your routes of drug administration, you are able to look at inhalers. And you can see that when you're producing a product to be inhaled into the lungs, the size of the particles is very important, okay? If the particles are too small, they will get to the bottom of the lungs and they will be inhaled out. If the particles are too large, they will actually get into the larger airways. They will not be able to reach the alveoli, okay? So that's why we are saying the drug may be very cheap, but without this device, the patient will not benefit from the drug, okay? So I hope that makes sense, okay? I just wanted you to be able to appreciate what this statement, that the public may consider packaging to be superfluous. In some cases, it's too expensive. It doesn't make sense for you to take a drug that is costing you 50 bob and put it in a package that is costing 300 shillings, okay? But the problem is, without the package, the drug is useless. Or in some cases, you may actually find that the drug is costing 30 bob, but the drug is very sensitive, okay? Unless you put it in a package that will protect the drug from oxygen, from moisture, from light, the drug will deteriorate. So because of that, you go and look for a package that contains all these characteristics to protect the drug, okay? So packaging, however, preserves the stability and quality of medicinal products and protects them against all forms of spoilage and tampering. Okay? So for that reason, packaging, you're allowed to have superfluous packaging. Okay? packaging material must conform to prescribed standards, particularly with respect to the exclusion of moisture. You do not want a package that will allow moisture to come into your product, exclusion of light, prevention of leaching of extractable substances into the contents, and prevention of chemical interaction with the contents. So this is what we are saying. When you pick a package, it should not allow entry of moisture. The moisture may lead to spoiling of your product. Again, if your product is sensitive to light, the package should exclude light, okay? Then we mentioned that sometimes you may have a package reacting with the product, okay? You don't want that to happen because sometimes you pick a glass bottle, but what happens is the glass releases substances that get into the drug, so that now you give the patient a drug that contains substances that were leached from the bottle and ended up in the product. You don't want that, okay? And sometimes you have a scenario whereby the glass reacts with the drug, okay? What happens when you have a chemical reaction? In science, if you have product or rather chemical A reacting with the chemical B, what do you get? You get a product, okay? Now remember, in this case, your packaging, you have your packaging and you have your drug. What you wanted to give your patient is only the drug, okay? Not a product of the reaction between your active ingredient and the packaging. Because remember, if the two react, you get a product that was not intended to reach the patient. So you may actually end up getting a scenario whereby the patient is reacting to some chemical products that were produced due to a reaction between your drug and your package, okay? So because of that, when you're picking packaging material, you have to ensure that that packaging material does not react or interact with the contents of the drug, okay? Any questions? Okay. If there are no questions, we will stop there for today. And I will see you, we will pick up from there next week. Next week, we agreed with your class rep, we will have class on Tuesday, 11 to 1. So that we won't have class on Wednesday next week. So next week's class will be Tuesday, 11 to 1. That will be the last class before we close the year. So we'll stop there for today. If there are no questions, then I will see you next week. Have a good evening.